I am back. So we'll continue to treat dysfunctional psoas by using 2 yoga postures and positional release therapy. So I will ask Mike to come into lunge position, so with the left foot forward, treating the right psoas. So while Mike places the hands on his hips, of course we know that we have to elongate through the crown of the head, the spine should be long, and we need to lengthen enough the sacrum and coccyx and lifting the lower belly in order to protect the lumbar spine. So Mike will be using hamstrings, inhaling, pulling the foot towards the opposite knee, and then as he exhales, he will go into the lunge till he feels the stretch in the hip flexor muscle on the right side, and he will stay there. Now, in order to be more efficient, once you have enough release in the psoas, Mike will raise left arm up, inhaling. So, and exhaling, he will lean gently to the side as he continue opening the hips. So that will be full stretch of right hip flexor muscle. So, and then inhaling, you will go back, releasing the arms down, and then we will lie down on the floor for the second position. Second position, we'll be using Setabandha Sarangasana, supported shoulder bridge pose, placing the block underneath the sacrum. So once the block is underneath the sacrum, we will stay for some time in this position. Of course, shoulders are adjusted, so C7 is not in contact with the floor, neck is slightly shortened. And then after some time, once your student or you yourself feel that there is enough release in the front of your abdomen and the hip flexor area, you will stretch one leg at a time, placing the heel on the floor and the other heel. This will be passive hip flexor stretches, both sides, both hip flexor muscle, using the gravity and position. Now, if you want to do a little bit use more efficient way, you would bend your one knee, raising the knee up, so that make sure block is firmly supporting your sacrum, and then we will raise the straight leg up, contracting the quadriceps and hip flexors for the moment. Imagine again that you're resisting someone's hand pushing your leg down. And after some time, as you exhale, let's say 8 to 10 seconds, we will let go, leg descending to the ground heel. That will be active phase to your next limiter barrier of stretching this particular muscle. So after some time, once you're satisfied, the muscle is stretched, you will release gradually your other knee to the ground, other foot, bending the straight leg knee, raising the hips up, taking the block away, and then we will lie down for some time, allowing the lumbar spine and lower back to sink to the ground. Now, we have 2 other positions that we will release tight or contracted psoas. So basically what we want to do, we want to compress and shorten the muscle in order to deprogram the nervous system to let go of tension. So we will straighten the legs, both legs. So Mike will move hips to the left. We will shortening the right hip flexors, moving the trunk a little bit to the side bending, bringing the right leg to the side and allowing the right thigh to roll out. And we will stay for some time in this position. That is a position, actually, action of hip flexors, shortening the muscle and allowing the tension to be let go of. So after this, second position will be to go back into neutral position, Mike, and I will bring the chair. So Mike will bend the knees. So we place the chair, raising the legs up. So placing the feet on the chair, crossing the ankles, allowing the thighs actually to roll a little bit out the knees, so which is again exact action of the hip flexor muscle, flexing the hip, abducting the thigh, moving the thighs to the side, rotating the thighs out, and hands across the belly, so, and allowing the whole body to relax and just breathing smoothly. And this is another position where hip flexors are shortened and then nervous system will be deprogrammed and tension will be gone after a certain period of time. You can stay a minute, 2 minutes, up to 3 minutes in this position, and then gradually you will take the chair away and let go of everything. So if you want to know more about therapeutic applications and different therapeutic methods, you come to see me and study with me in Taipei and Kaohsiung. 再见。